Professor Eyitayo Lambo.
Yes, please.
As
Michael.
a Minister of Finance, Minister of Health, I beg your pardon, who was an economist and perhaps may have been better suited to be the Minister of Finance, I think you are in a fairly unique position to be able to suggest to Ministers of Health in their dealings with Ministers of Finance how they can be more effective advocates for their own sectors. And one of the points that I have heard suggested is that Ministers of Health need to become more proficient in economics, essentially, which isn't to say they all need to become economists, but they need to understand the frame of reference, the language, the attitude of the economists who run the budget. What are your suggestions?
Thank you very much, Michael. I think the point you've made is very, very important. Before I directly answer the question, you're right, because if you go to a typical Ministry of Health in Africa, and if I give you the example of the Nigerian example, the minister can be a doctor, but there are occasions when they have not been doctors. Most of the senior officials of the ministry are doctors. They are not just ordinary medical doctors. Highly trained, specialized, surgeons, and so on and so forth. I remember I had about 60, doctors of all kinds of specialties in my ministry, and they've been there for 20, 30 years, that kind of thing. But then I came in there as a minister, and I was the first minister of health who is an economist. And I think that put me at an advantage in the sense that Ministry of Finance, that is in charge of budget preparation, you can say they are in charge of allocation of budget, although they are, the role of the minister, he or she doesn't have full authority in doing this. It has to relate with the president. But he or she is seen as the one to allocate, okay? Now, the days are gone, Michael, and this is one of the things that doctors who are ministers of health don't realize. The days are gone when you can run to a minister of finance and say, look, people are dying. I need $1 million. Before you say, oh, yeah, fine, but the president wants a jet plane, and he's my boss, what do you want me to do? No, talking seriously, what I'm saying is, in almost all countries in Africa, almost all, even in developed countries, not to talk of developing countries in Africa, resources are limited. And the various sectors, including health, have increasing demands for resources every year. Poor Minister of Finance has to sit down and think of, how do I allocate these resources? So you cannot just come and say, I need $1 million, and you think you will get the $1 million. No matter how friendly you may be with the minister, the minister wants you to make just, why should I give you the $1 million and not give her $1 million to another ministry, or $2 million to another ministry? And so you have to speak their language. And the language is to show the value, you are going to get, the government is going to get for the money they are putting into health. Or, put it differently, how spending that $1 million will contribute to the attainment of the objectives of government for the year or for the planning period, that kind of thing. Okay? So, ministers of health must learn, who are not economists, they must learn how to speak the language of the finance minister. And what that means is not, I'm not talking about accounting. Largely, many of these ministers of finance they have economic background. So some knowledge of economics, okay, beyond the level of Eco 1, Economics 101, at least that we, expose them to certain concepts in economics and how to apply those concepts, like value for money. It's an economic concept. What does it mean? A a minister who is a medical doctor must know what this one means. Efficiency, equity, sustainability, and all these things. So that is very important. And Michael, I think one thing that is clear in many of the African countries, or to many of the ministers, is that they really don't know how to articulate their views. I mean, a ministry has its own priorities, okay? The priorities must be expressed in a document, that may be the policy document or the plan document, but then there must be justification for putting every item that you have in that document there. Because you cannot implement any of those activities without money. And at the end of the day, the Ministry of Finance must know what they are going to get. You know, there must be certain deliverables. So it's not a question of just saying, I want to build a health center somewhere, okay, at a cost of $2 million US. How is that going to contribute to the achievement of the government's goals? Reducing, increase, first you can look at the output. What will be the outputs? What will be the outcomes? What will be the impact? Those must be demonstrated. And therefore, there is need, and serious need for that matter, for ministers of economics, ministers of health, to understand basic economics and use these concepts to provide some evidence that they will use in backing up, their demands. That is when they are trying to communicate, in a way that Ministry of Finance will consider their request. I'm not saying they will consider the request 100%, but at least they will see the justification for what they're asking for.
Yes. Yeah. Well, historically, traditionally, the justification for health expenditures have been largely in terms of health outcomes.
Yeah.
In other words, we immunize X number
That's
of people.
Right. That's right. That's right.
Benefits.
That's right.
And that capacity is generally
lacking.
It's in most health ministries, or it can be out.
They can get sure.
But what is seemingly lacking is the other side of the same coin, which is the need to be able to justify that in value for money terms.
That's right. Sure.
So if it's going to cost us X,
that's right.
Y,
that's right. That's right.
Is that the best use of X?
That's right. That's right. There are some other alternatives, Yeah.
Exactly.
Yeah.
My question is, ought to health ministries consider building into their spectrum of capacity a health economics unit?
Yeah, thank you for asking this. We were discussing this during a roundtable in the morning, and I was saying, well, I probably had a good time with the Minister of Finance. I was able to make my case. I was able to get the resources I wanted, but I failed to do something because after I left, there was nobody to speak that language to the minister. And you heard what the Minister of Finance was saying happened after I left. Okay. So one of the things that I regret I didn't do was to build some capacity in the ministry. I think having an economics unit or half economics unit might be one of such. I think I can look at it at two levels. One is that the senior officers you have in the ministry, and I said there are about 60 of them, and they are on the highest level of government salary, in Nigeria. I think we should have exposed them to some basic. They should have gone through some training on economics, concepts and some of these things. Okay, that's number one. So that every one of them. But in addition to that, what you have just suggested could be relevant. To have a small 3, 4, 5, health economics team in the ministry, because they would now be able to provide, the support to a minister, particularly a minister of health, that comes in without a knowledge of economics.
Right.
So I agree with you.
Right, and the issue of continuity and
Yeah.
institutional sustainability
Yeah.
is incredibly important, and obviously having a health economics unit is in part
Yeah, sure.
the answer to that. But the other side of that question is this issue that so often comes up of the inefficiencies, the corruption, which is inherent in the health system because it's a very open system. There's many valued commodities and so on. And so, how does the Ministry of Health get to grips with that? It's almost, as you say, when you have non-managerial people in the position of minister.
Yeah.
How does that person say, this is a priority, we have to get our management systems right, we have to eliminate inefficiencies, we have to build the management capacity at local level, etc. It seems to be a profound problem across many health systems.
Yeah, I will not stop at that. I will even say it's a problem across all sectors, particularly if you take Nigeria. Waste, corruption, inefficiency abounds. Okay, but when you come to the health sector, again, one of the ways in which you can attack that is to put in place, like you rightly said, the right system, the right managerial system, management systems. Take procurement as an example, and I think we are doing fairly well in that in Nigeria. Before 2003, it was terrible, okay? But then there is a procurement system that has been put in place. We call it due process. So the procuring is one thing. You must make sure you do everything to procure the right thing at the right price and it's delivered on time. So what that system, which has been built, and that's a very good example, has done is to save the government, particularly in the Ministry of Health. I say mine as if I'm still there as Minister of Health. What that has done is to save the ministry and other ministries billions of dollars every year in terms of, because before this procurement system came into place, I can give you an example that they could just ask a supplier to supply something, okay, and the supplier dictates, how much, gives the price, and that is it. But now to buy anything, there must be advertisement in the paper. You must give at least 2-3 weeks notice and say it will close, the tender must close at a particular time of the day, and you give the date. And when the thing closes, you bring all the responses to the table. It is opened, with cameras around and so on and so forth, and they read the various submissions and so on and so forth. And then, of course, that's the beginning of the process. Ultimately, they will select somebody. That has reduced the cost of purchase of many of the things by at least 30%. Yeah. So, but then that is not to say that you are eliminating corruption, because even within that, there is still room for yeah, but I agree with you that some of these systems can be put in place, but I think it's a system-wide thing. It's not just in health, Ministry of Health. It's across, yes. But I think health, if you have an economist, in health as minister, he could initiate some of these things more, or sooner, or, than a medical doctor being the head of that. That's right.
Well, thank you so much.
Yeah.
This has been very useful.
Thank you very much. Yeah.
All right.